Hello, everyone. In our revision lesson today, let's discuss electroconvulsive therapy, also referred to as ECT, and cognitive behavioral therapy, also referred to as CBT, as a treatment and management technique for schizophrenia. Now, to be able to revise this, I have picked up a question from May-June 2024, paper 3, variant 2, A2 psychology, clinical psychology. Now, this is question number 4A, and the question over here reads, describe electroconvulsive therapy and cognitive behavioral therapy for the treatment and management of schizophrenia. This is a typical 6-mark question that is followed by an evaluative question that is worth 10 marks. So for this 6-mark question, as we clearly see, the examiner is expecting us to describe two different treatment and management techniques. So it wouldn't be wrong for us to dedicate 3 marks for each. But remember, the purpose isn't just to answer this particular question. The purpose over here is to help you with revising electroconvulsive therapy and cognitive behavioral therapy. So without any further ado, I'd want to move on to the revision part. Let's discuss the topic first, and then we would link it with the question to see if based on the information that we have acquired, based on the knowledge rather that we've acquired, if it actually helps us answer the question. So to begin with, what exactly is electroconvulsive therapy? Electroconvulsive therapy, also referred to as ECT, is a medical treatment. It's a medical treatment that is used to help manage severe mental health conditions, such as schizophrenia. Now, talking about ECT, as we talk about ECT, ECT is a biological treatment. We should be aware. ECT is usually used to alleviate symptoms of schizophrenia. It doesn't cure schizophrenia, it helps you with alleviating symptoms of schizophrenia. And yes, because electroconvulsive therapy involves passing electric current through human brain, it has always been considered to be very controversial. Taking this ahead, if we speak about how ECT works, now when we talk about what actually happens during an ECT procedure, so what happens is the patient is placed under general anesthesia so that they're asleep and they do not really feel anything. Along with that, a muscle relaxant is usually given to prevent injuries during seizures. Electrodes are placed on the scalp, and a small current is passed through the brain. This is supposed to trigger a controlled seizure that lasts around 30 to 60 seconds. So in a nutshell, if we talk about how ECT works, generic information or general information, this is how it typically works. Now, if we talk about ECT, patients typically have to undergo a course of ECT treatment ranging from 6 to 12 sessions. And this is typically given to them twice a week during treatment period. Along with that, it is also important that you keep in mind that ECT is nowadays applied unilaterally, that is from on one side of the brain, that too to the non-dominant hemisphere, to reduce memory loss. So one of the major setbacks, or one of the major setbacks or a disadvantage of using ECT is memory loss, short-term memory loss, but nonetheless memory loss. So if the therapist, if the practitioner administers ECT unilaterally, that is, uni means one side of the brain, that to the non-dominant hemisphere. What does the word non-dominant hemisphere over here means? If we talk about our brain, if we divide it into two sides, the part of the brain that is not active, right, or the part of the brain that is rather say less active, right? So ECT is now applied unilaterally to the non-dominant hemispheres to reduce memory loss. Taking this a little further, the question that rises over here is, why does all of this help? So what happens is the seizure that we're talking about, right? This controlled seizure that we're talking about, this seizure affects brain's chemistry. Specifically, there are two key neurotransmitters that get affected, that is dopamine and serotonin. And if you remember, we have always spoken about how the biological explanation claims that it is an imbalance. It's an imbalance in the neurotransmitters that leads to individuals developing mental illnesses. So, if I put it in a simple manner, what ECT tries doing is ECT tries to fix that, or tries to reboot, or tries to restart brain functioning by by correcting, or by fixing that imbalance into a balance. Now, moving on, if we talk about how specifically does ECT work when it comes to our brain chemistry. Now, this is something that I've seen many students. I've seen many students asking this question. So, if I may break it down into three parts, in schizophrenia, particularly when symptoms like hallucinations and delusions occur, there is often overactivity of dopamine in certain areas of the brain. So, we're talking about an overactivity of dopamine in certain areas of the brain. So, what ECT does is ECT works like a reset button. The seizure reduces dopamine activity, helping to bring it back to normal levels, right? So remember, I had used the word imbalance, right? I had used the word imbalance. So what ECT tries doing over here is ECT through a well-controlled through a well-controlled seizure, what ECT tries doing is it's more like a reset button, right? It tries to reduce dopamine activity. So they see if there's overactivity of dopamine, that would be considered an imbalance. So that overactivity of dopamine is reduced so that it helps the patient it helps the patient's dopamine levels to get back to normality. Likewise, if we talk about another neurotransmitter, that is serotonin over here. Serotonin, as we all should be aware, affects our mood, affects our motivation, and affects our emotional stability. And low serotonin can lead to symptoms like withdrawal and lack of motivation. Again, negative symptoms of schizophrenia. So it wouldn't be wrong for us to say that ECT increases serotonin release and improves brain cell response. This helps with mood, motivation, and emotional stability. Now, we are discussing all of this under the heading of the brain chemistry and what exactly happens in the brain that we can say affects the patient, or rather say helps the patient get well. So the third, if I conclude this, if I talk about this brain reset, think of ECT such as rebooting a computer. So, what happens is the seizure disrupts abnormal brain activity and it strengthens connection between brain cells, which improves the overall brain functioning. So, this is the simplest way we could understand what ECT actually does to you. Taking this a little further, and if you talk about the use of ECT in schizophrenia, how useful is ECT for schizophrenic patients? To begin with, ECT is particularly effective for catatonia, or catatonic schizophrenia, as it was formerly referred to. Now, when we talk about catatonic schizophrenia, this is when a person may become unresponsive, immobile, or stuck in repetitive movements. So, it has been seen there's enormous amount of evidence that shows us that ECT has been particularly more effective for catatonic patients. Number one. Number two, if we take this a little further, ECT has been seen to be working for treatment resistant patients too. Now, for some individuals, antipsychotics do not work. There are some individuals who might be showing resistance towards medication, resistance towards antipsychotics, and this is when ECT comes into play. Another thing that we should know is ECT typically helps individuals or patients who have severe positive symptoms. Positive symptoms like extreme hallucinations or delusions that do not respond to medication may improve with ECT, right? They may. And likewise, the fourth point that I'd like discussing over here is the patients who have a high risk of self-harm. So ECT, because it works much faster than medication, it wouldn't be wrong for us to say that it is a life-saving option for patients that are at immediate risk. Now, taking this ahead, moving on, if we speak about the effectiveness of ECT, how effective is ECT? Now, to begin with, ECT, like I mentioned on the previous slide, ECT is most effective for catatonic symptoms, patients who have catatonic symptoms, with most patients showing significant amount of improvement. Number two, in treatment-resistant patients, like I said, ECT combined with, right? If you're combining ECT with antipsychotics, it has been seen that many patients experience an improvement too. And number three, if we talk about if we try scrutinizing ECT, it wouldn't be wrong for us to say that the effect that ECT has is pretty temporary. So the effects of ECT are often temporary. Patients may need follow-up treatment with medication or additional ECT sessions as well. Now, that being said, if we move on towards the advantages and disadvantages of ECT, because we've discussed, has a rapid response because it works faster than medication. It can be seen, or it should be seen, as an advantage here. Number two, it can often turn out to be life-saving in severe cases where patients, when you fear that the patient might self-harm himself or herself. However, if you move on towards the disadvantages of ECT, the first one over here is ECT can result in short-term memory loss, confusions, headaches. If you remember, we had spoken about how instead of using ECT bilaterally with the passage of time, in recent times it has been seen that ECT has been administered unilaterally, that too to the non-dominant hemisphere of your brain. One. Number two, there's always a negative stigma that is attached to ECT. It doesn't sound very right when you talk about electric current being administered, right? So it has always carried a negative stigma. The perception held by public about ECT isn't very favorable. And number three, this relief is temporary. And because this relief is temporary, there has to be something, like usually it's antipsychotics along with ECT that work out well for the patient. Now, we were talking about electroconvulsive therapy. If I may say, that modern ECT is a much more refined version of traditional method. Nonetheless, it is still controversial. It is controversial because it involves passing electricity through the brain with the intention of inducing a seizure. Remember, we're just passing electric current so that you could induce a seizure, a controlled seizure under supervision, right? A controlled seizure under supervision. Now, if we talk about ECT, like I had said, patients usually undergo a course of ECT treatment ranging from 6 to 12 sessions, although some may need fewer, to individual differences here. It is typically given twice a week during the treatment period, or less commonly at longer intervals to prevent relapse of symptoms. So if the patient is going through the treatment period, usually it's twice a week. However, when the patient is done with the treatment period and is going through going through remission, that is when ECT or ECT administration becomes lesser, and that is when you are administering ECT just to prevent relapse of symptoms. Like I said, instead of applying ECT bilaterally, I'll just put this over here. So yeah, instead of applying ECT bilaterally, that is across both brain hemispheres, it is now applied unilaterally, right, to the non-dominant hemisphere only to reduce memory loss. Despite improvements to the technique, there are significant risks that are involved to individuals. The procedure affects the central nervous system and cardiovascular system, which can be dangerous for those with pre-existing medical conditions. So if you're talking about someone who has a pre-existing medical condition, it can turn out to be dangerous. Memory loss is still a common side effect of ECT, but this is usually very temporary. More serious but extremely rare side effects can include lasting neurological damage or a skull fracture, which can result in death as well. Now, about ECT, it wouldn't be wrong for us to say that there's still no general accepted explanation for the effect ECT has on the treatment of mental disorders. Understand this part, understand this line, that there is, even to this date, there is no general, there is, even to this date, there is no general accepted explanation, or unanimously accepted explanation when it comes to how this ECT works. Nonetheless, there are several theories that are associated with ECT as to how it works and what all it does. And it was when, if you remember a couple of minutes ago when we were talking about brain chemistry over here, that was just one theory amongst many others that people tend to use when they try to advocate the usage of ECT. Now, moving further, there's this yeah, before I forget, there's this another theory that it affects post-synaptic responses to central nervous system transmitters. Now, what does this mean? Uh, what are post-synaptic responses? For this, we need to know what a synapse is. A synapse, like we have discussed multiple times in our class, a synapse is the tiny gap between two brain cells, neurons, when neurotransmitters are released. Now, when we talk about the difference between presynaptic neuron and postsynaptic neuron, presynaptic neurons, this is when the presynaptic neurons, this releases neurotransmitters like dopamine or serotonin into the synapse, and postsynaptic neuron receives this neurotransmitter through specific receptors, leading to a response. Now, how does ECT help? Again, the idea is very simple. ECT increases the availability of neurotransmitters like serotonin and dopamine, along with that norepinephrine as well. But that would we do not want to get into a lot of details here. So moving on, ECT is rarely used in the treatment of schizophrenia because of a lack of empirical evidence to suggest it is more effective than other forms of therapy, such as antipsychotics. So ECT has been very, very rarely used as a replacement of antipsychotics. Yes, it has been used along with antipsychotics. Evidence suggests that ECT can be effective during acute episodes of psychosis where fast, short term improvement of severe symptom is needed. There's also some evidence indicating it may be most effective for individuals experiencing catatonic symptoms, and this information was released by NICE in 2015, and NICE over here is National Institute for Clinical Excellence. Now, this is, I believe, enough for you to know about how ECT works, what ECT is. Let's just see if this works according to the marking scheme that has been published by the Cambridge, right? The published marking scheme by the Cambridge. So the question over here was, describe electroconvulsive therapy and cognitive behavioral therapy for the treatment and management of schizophrenia. If we have a look at the guidance over here, award up to 4 marks where the response has described only one part of the question, even if the response otherwise meets the criteria level for 3. So that's a very clear signal by the examiner. If they're asking you about 2 things, you might as well respect that demand and write down about both of the aspects over here. So for full marks for ECT, need to refer to seizure. Remember, I kept on mentioning the word seizure. So ECT, you're administering ECT. I mean, you don't want to pass you don't want to pass electric current through a human brain for any other reason but to administer a well controlled seizure under supervision. So for full marks for CBT, needs to refer to how it will reduce symptoms of schizophrenia. I mean, the second part of the question that we haven't revised as yet. For CBT, I mean, there's a possibility someone might just end up writing down about CBT. Remember, my dear, you need to connect how CBT helps reducing symptoms of schizophrenia. ECT, no credit for side effects. So yeah, since we were revising, I helped you with the side effects, but you will not get any credit for writing down the side effects in this particular question. In the next question, where you have to evaluate, oh yes, sure. CBT does not treat causes of schizophrenia or the past trauma. Sensky, the example study that is a part of our syllabus. If you're writing down about Sensky, you need to give a brief outline of CBT treatment for full credit. Having a look at the question here, I mean, we've read the question already twice. Moving on, candidates must discuss both electroconvulsive therapy and cognitive behavioral therapy for schizophrenia. But they do not, now focus on this part, but they do not need to use the Sensky example in the study, in the syllabus. I mean, you do not need to. You want to use it, you use it. But I mean, remember, I have been saying this very often. You cannot get direct questions on example studies. I mean, for key studies, or yes, for example studies, they won't name an example study and ask you anything, right? So even over here, but they do not need to use the Sensky example in the syllabus. Now, talking about electroconvulsive therapy over here real quick, since we've revised it already. This is a general anesthetic and a drug that relaxes muscle is given. Oh, wait, a general anesthetic and a drug that relaxes muscle is given. Electrodes are placed on the scalp and a finely controlled electric current through those electrodes for a very short time. This will cause a brief seizure in the brain. Focus on the word seizure over here. It can be performed unilaterally or bilaterally. It targets positive symptoms for severe cases of schizophrenia. If we talk about the effects of ECT, if covered in response, it affects postsynaptic response to central nervous system transmitters. It is used during acute episodes of psychosis. ECT may increase the release of neurotransmitters such as serotonin, dopamine, and norepinephrine. You should ideally not sound very deterministic. So the word may, I believe, uh, makes more sense here. Moving on, ECT activates the dopamine system at various levels, including hormone release, neurotransmission, and receptor binding. Now, I think this is enough, or rather say more than enough for 3 marks. Try putting your pen to paper. Try putting your pen to paper. I have been asked very often, oh, sir, how much is enough? I mean, the more you write, the better it is. But remember, everyone has a different writing speed. So try focusing on the key areas, try focusing on what is important instead of getting too deviated or getting too carried away with things that might not help you with marks. Moving on towards the cognitive behavioral therapy part. Now, cognitive behavioral therapy, as we have discussed earlier, it is a talking therapy. The word cognitive behavioral therapy in itself explains you change the cognitions, which consequently would change the behavior. And to be able to change the cognitions, the patient needs to be made to understand that it is illogical, irrational, maladaptive cognitions that are causing trouble. So those illogical cognitions, those illogical thoughts need to be identified first, and after identification by the therapist, and of course by the patient as well. After identification, then they need to be challenged, and once you challenge them, because remember, you are trying to change illogical, irrational thoughts into something that is more logical and makes more of sense. So talking therapy that involves cognitive restructuring, the therapist and patient discuss the goals of the therapy, which are problem focused, often for 5 to 20 weeks. For schizophrenia, this could involve reducing delusions, ignoring hallucinations, and or coping strategies. We'll discuss issues, example, delusional thoughts with therapist, and set homework to challenge thoughts during the week. For example, if the patient has a delusion that they're being followed by spies, the therapist could acknowledge that it is possible, but question why spies would be interested in the patient and suggest who else it might be. Example, friends out for a walk. As therapy, there's more. As therapy progresses, the patient learns how to challenge their thoughts and become aware of improvements in symptoms. Now, do you realize whatever I had just said a couple of minutes ago about how CBT works generally? All of that has to be added, or all of that has to be integrated with your knowledge on schizophrenia. Like, it could help reduce delusions. It could uh, you could teach the you could teach the patient to ignore hallucinations. Now, an amazing movie, A Beautiful Mind, I keep on suggesting students to watch that. I think the spies example has been picked from that movie by the examiner as well. So yeah, a very nice movie though. If you want to understand schizophrenia, you watch that movie, you'd come across ECT over there as well. But yeah, tiny little disclaimer, a movie is a movie. Even when most part of the movie it would help you with a better understanding, but you cannot expect the movie to be scripted totally according to your syllabus. So yeah, a few things that would help us with evaluation later, but yeah, I think we'd be discussing that in another lesson. So there's a key study by Sensky. I just highlight this over here. You could pause this, read it over here, so that you could I mean, I could explain it to you, but that is going to take us a lot of time, so I'm trying to avoid that. I'm trying to keep these lessons as short as I possibly can, while at the same time trying to ensure that they're effective enough. So yeah, for these studies, uh, I mean, I could show you more of content on this as well that might help you. So yeah, you could pause this here, read through this as well, and this part too. I hope this has been helpful. Thank you.